So in this we discuss the competency, that is explaining the anatomical basis of phimosis and circumcision. The concept of circumcision is defined as the resection of part of the penile foreskin. Procedure involves removal of a sensitive and intimate anatomical region which may evoke strong emotional reactions. So the picture showing the phimosis and the normal. Phimosis is a congenital or acquired condition. It is a condition in the penis characterized by natural balano-preputial adhesions, sometimes even excess foreskin. Various degrees of constriction are found in the opening, which prevent total or partial exteriorization of the glands. The male genitourinary organ ends with a conical and smooth shaped glands. Skin that covers it is called foreskin. It extends in a loose fold and covers the glands. The inner portions of the prepuce are lined with mucosa and are in close contact with the glands. Circumcision corresponds to the excision of the distal prepuce. It is one of the most widely or frequently performed surgeries in children worldwide. In 1997, the incidence of circumcision was 62.8% in the United States and 35% in certain regions of Canada. On the other hand, it is infrequent in Asia. About 1/4 of men are circumcised for medical or non-medical reasons or simply at their parents' option. Societies that practice circumcision fall into two groups. The first includes the Muslim, Jews and others, where circumcision is proposed to unify society religiously and culturally. The second group includes mainly the Anglo-Saxon countries, where circumcision has a preventive purpose. Historical context. Studies have revealed that there is a routine indication of circumcision among certain people, only varying in time of execution. In Madagascar, they perform circumcision between 1 to 2 years. In Murgin, in Australia, perform it on boys between 6 to 8 years. The Javanese perform it at ages of 5, 10 or 14, and Nidungu perform it at the onset of puberty. Being a religious factor, the Israelites perform their baptism, literally the covenant of circumcision or covenant of Abraham with God, with circumcision on the 8th postnatal day. Among Islamists, it can be done on the 7th day of birth, or in Muslim law between the ages of 17 to 30. Only in the 18th century did the circumcision become prominent in the West, particularly in England, initially as a public health measure. Shortly afterwards, circumcision entered United States initially as a public health strategy. Over time, circumcision became a symbol of American nation, being performed routinely in the neonatal period with indices superior to all countries in the world. In North America, hospitals 80 to 90% of newborns are systematically circumcised without distinction of race or creed. In England, 70% of all circumcisions performed annually are for patients under the age of 15 years. According to medicine, pediatricians who do not indicate surgery in those do not maintain sphincter control even when they present with urinary symptoms. These doctors prefer to clinically treat the preputial affection until the removal of the diapers and then indicate surgical treatments. It is difficult to decide whether a child or baby should undergo circumcision. Thus, according to Concepcion, circumcision should be considered only in children with true phimosis associated with inflammatory or infectious symptoms such as dysuria and relapsing balanoprostatitis, and in cases of paraphimosis develops. In fact, there are very few cases of children requiring circumcision. Phimosis. Although there are many medical indications for circumcision, phimosis appear to be the most frequent. Paraphimosis is a urologic emergency requiring preputial reduction using surgical methods or other methods. It represents the second main indication for circumcision. Thank you.